Hepatocellular carcinoma. Hepatocellular carcinoma is a cancer that starts in your liver. It's different from the secondary liver cancers, which have spread to the liver from other organs. If caught early, it can sometimes be cured with surgery or transplant. In more advanced cases, it can be cured, but treatment supports can help you lifelong better.
Develop in these inflamed nodules. The major cause for hepatocellular carcinoma has been hepatitis C, which has been one of the leading causes of cirrhosis. But more recently, we're seeing increasing numbers of patients with hepatocellular carcinoma who have fatty liver disease and have fibrosis, not just cirrhosis. So any inflammation in the liver can cause these tumors to develop. For most patients with hepatocellular carcinoma that present to our center, we evaluate them for liver transplant if they come in in the setting of cirrhosis. The other option is surgical resection or cutting the tumor out. And for those patients who are not suitable for transplant for one reason or the other, they may be suitable for a resection. Not everybody is suitable for resection, and it depends how bad the liver disease is, clearly. And the third modality is treatment from the interventional radiologist with either wires that go into the tumor and burn them from the inside with chemotherapy, or burn them from the outside through wires that come into the liver from the outside. All of these can be combined to get the best results for the patients. The advantage we have at New York Presbyterian for treating such a challenging disease is that the surgeons here are capable of resecting and transplanting the livers. We have experts in interventional radiology at treating these tumors. When you have a multidisciplinary team that's composed of surgeons who do research on the disease, who can cut the liver out or can transplant the liver, as well as hepatologists who are invested in researching the disease, and oncologists and radiologists, you get a better result for the patient overall. And the patient is directed towards the most appropriate care, rather than being filtered into what the center is an expert at. We're an expert at all three modalities of treatment rather than just the one.
Causes: hepatitis B or hepatitis C. Hepatocellular cancer can start many years after you have one of these liver infections. Both are passed through the blood, such as when drugs users share needles. Blood tests can show whether you have hepatitis B or C. Cirrhosis: this serious disease happens when the liver cells are damaged and replaced with scar tissue. Many things can cause it: hepatitis B or C, alcohol drinking, certain drugs, and too much iron stored in the liver. Heavy drinking: having more than 2 alcoholic drinks a day for many years raises your risk of hepatocellular cancer. The more you drink, the risk you have.
Hepatocellular carcinoma. Chronic hepatitis B is the most common cause worldwide. Chronic hepatitis C is the most common cause in Europe. The main risk factor for developing hepatocellular carcinoma is liver cirrhosis. For example, secondary to hepatitis B and C, alcohol, hemochromatosis, and primary biliary cholangitis. Features: tends to present late. Features of liver cirrhosis or failure may be seen: jaundice, ascites, right upper quadrant pain, hepatomegaly, pruritus, splenomegaly. Possible presentation is decompensation in a patient with chronic liver disease. Screening with ultrasound, with or without alpha-fetoprotein, should be considered for high-risk groups such as patients with liver cirrhosis, secondary to hepatitis B and C, or hemochromatosis. Men with liver cirrhosis secondary to alcohol. Management. The only proven potentially curative therapy for hepatocellular carcinoma remains surgical, either hepatic resection or liver transplantation. Hepatic resection should be considered as a primary therapy in any patient with hepatocellular carcinoma and non-cirrhotic liver. Liver transplantation should be in any patient with cirrhosis and a single small hepatocellular carcinoma less than 5 centimeters, or multiple up to 3 lesions less than 3 centimeters. Non-surgical therapy is only used when surgical therapy is not possible, and with extrahepatic dissemination. Percutaneous ethanol injection has been shown to produce necrosis of small hepatocellular carcinoma, and is best used in peripheral lesions. Transarterial chemoembolization can produce tumor necrosis and has been shown to affect survival in highly selected patients with good liver reserve.
Symptoms: pain in the upper right of your belly, a lump or feeling heaviness in your upper belly, bloating or swelling in your belly, loss of appetite and feelings of fullness, weight loss, weakness or deep fatigue, nausea and vomiting, yellow skin and eyes, pale chilic bowel movements, and dark urine.
Specific. But the most common way that liver cancer is diagnosed is when someone goes in to their primary care doctor or their gastroenterologist for a routine follow-up and has some blood tests that come back abnormal. Their liver function tests are abnormal. Another way that patients present when they have some symptoms is abdominal pain. Sometimes liver cancer can stretch the capsule of the liver and cause pain. Occasionally, patients develop water buildup in their stomach, also called ascites, and their stomach seems bloated, and that may be how they presented and the diagnosis was made. And occasionally, patients present at a later stage with yellowing of their eyes. But more and more, we're seeing patients going in for surveillance or screening and finding patients diagnosed with liver cancer that way.
Getting a diagnosis. Have you had any pain in your belly? Are you feeling weak or tired? Is your appetite down? Have you lost weight? Overview. What to expect? For some people, treatment makes the cancer go away. For others, the cancer may not go away completely or may return. If that is the case, you may need a regular treatment to keep the check as long as possible. Your treatment to fight liver cancer may stop working. If that happens, you may want to focus on making sure you're as comfortable as possible, not as palliative care. You may not be able to control your cancer, but you control choices about how you live your life.
And substages, it helps to understand the criteria for judging what a liver cancer stage is. A stage is simply a way of describing how far cancer has progressed and what form that progress has taken. It's important to remember, however, judging a liver cancer stage is more complicated than judging stages for other types of cancer because liver cancer patients may also have liver damage. This fact makes a difference in determining the prognosis and treatment possibilities. The lower the stage, the more likely it is treatment will lead to a positive outcome. The judgment of a stage depends on the size of a tumor, the location, is the cancer present in just one lobe or both, the spread or extent of the cancerous cells. The third criteria is divided into two parts. Has the cancer grown into or around blood vessels? Has the cancer spread into adjacent lymph nodes or organs? Using these criteria to judge the stage of liver cancer, medical professionals and researchers have come up with the following groupings. Stage 1. The tumor measures 2 centimeters or less, occupies a single area, and can be removed surgically. Stage 2. Cancer occupies one or more locations but hasn't spread to nearby blood vessels or lymph nodes. When this is the case, doctors divide stage 2 into two more possibilities. There's a single tumor 2 centimeters or more present, or there are several tumors, all less than 2 centimeters in diameter, and the cancer is present in only one lobe of the liver. Stage 3. Liver cancer at this stage is considered to be advanced and is divided into several substages. Stage 3A. The cancer has not spread to other organs or lymph nodes. This stage is further broken down in two ways. There's one tumor, larger than 2 centimeters, and nearby blood vessels have been affected. There are several tumors 2 stages or larger, and nearby blood vessels have been affected. Stage 3B. Tumors can be of any size, and cancer cells have spread to adjacent lymph nodes without affecting other organs. Nearby blood vessels may or may not be affected. Stage 4. At this stage, liver cancer is judged to be disseminated or diffused, meaning one or more of the following. The cancer has spread to more than one lobe of the liver. The cancer has spread to other parts of the body. Tumors can be any size or number. Blood vessels are affected, and nearby lymph nodes may or may not be involved.
Thank you.